Hey everyone, Dr. D here, and it's time for exam 4 review with our Talaro's Foundations in Microbiology 12th edition by Barry Chess. This review covers chapters 20, 21, and 22. Let's go ahead and get started.
Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. Explain stuff.
All right, exam 4 review starting with chapter 20. Let's go ahead and start this review. All right, starting off with Pseudomonas aeruginosa, we learned about this particular species. You should know that this is found in soil and water, though it is also an intestinal microbiota. You should know that this particular species is very resistant to soaps, dyes, quaternary ammonium compounds, drugs, drying out. And so that makes it an opportunistic pathogen, specifically at the clinic, right? It's a nosocomial infection that can be picked up from equipment that has not been cleaned properly. That, of course, leads to skin infections. Pseudomonas, remember, also produces this really neat bluish green pigment when it grows. We also learned about Burkholdia pseudomallari, which is acquired through a penetrating injury or inhalation. Remember, it caused those nodules in the lung. And remember, all of these concept check questions may appear on the test. So, for instance, you should study this one. The main reservoir for Pseudomonas aeruginosa is, we just touched on this, remember, it's soil and water. Next, you should remember that we learned about brucella, and brucellosis is also known as Malta fever, undulant fever, and Bang disease. It's zoonoses that's transmitted to humans from infected animals. We also learned about this. This one's so important. Do you remember Bordetella pertussis? You should know that this causes the disease pertussis, or whooping cough. You should know that there is a very effective vaccine against Bordetella pertussis. It is part of the DTaP mixture of vaccines. We also learned about Legionella pneumophilia and Legionellosis. You should know that this is the one that causes Legionnaire's disease and Pontiac fever. And do you remember, this is the bacteria that lives within amoeba, right? And so the bacteria live within the amoeba. The person comes into contact with the amoeba, and that's how you pick up this disease. You should know about the family Enterobacteriaceae. Remember that enteric bacteria are found in the guts. And you should know that these are the opportunistic Enterobacteriaceae. But you should also realize, you should make a note of this, that the true enteric pathogens, the primary pathogens that are enteric are Salmonella and Shigella. These are true pathogens, whereas the previous list I showed you, those are enteric opportunists. You should realize that lactose fermenter enteric bacteria are called coliform bacteria, and they are indicators of fecal contamination. E. coli is the main coliform bacteria that's looked for. And concept check time. Again, please make sure you know these concept checks. Which of the following is true about enterics? Some are normal flora, yes. Some release endotoxin, yes. Some release enterotoxins, yes. All of the above is true. And remember, with regard to E. coli, many strains are not harmful. They are simply part of your gut microbiota. However, there are some pathotypes, pathogenic types. You don't need to memorize all these different pathotypes of E. coli, but I would want to remember that this one's particularly bad. Remember this strain of E. coli called O157H7? This one, it causes hemorrhaging inside of the intestines. And that's because it picked up that Shiga toxin from Shigella, a true pathogen. And A couple of notes about E. coli. Again, E. coli is present in our guts. However, it is responsible for 70% of travelers' diarrhea, as well as 50 to 80% of UTIs. So I may want to remember that factoid as well for the exam, that E. coli does cause, diarrhea and UTIs. We also learned about other coliforms like Klebsiella pneumoniae, which causes pneumonia, as well as some other infections as well. Enterobacter, which causes UTIs. Uh, Citrobacter, which again causes UTIs. And Serratia marcescens, which can cause pneumonia as well. And by the way, that's another thing you should realize for the exam. Klebsiella pneumoniae obviously is not the only cause of pneumonia, is it? It's one of the causes of pneumonia, but it is not the only cause of pneumonia. There are several microbes and viruses that can cause pneumonia. And same thing with meningitis, right? There is no one cause of meningitis. Many different microbes can cause meningitis, including viruses. And again, those true enteric pathogens, Salmonella and Shigella, these will cause disease if they are ingested, and they cause gastrointestinal disorders. Do you remember Salmonella bongori? We learned that this is a species of salmonella that's found exclusively in those cold-blooded animals, right? So do remember that one. That's an interesting one. However, Salmonella enterica, these are the ones that, end up being ingested by most humans and causing that intestinal distress. So you should know that Salmonella is a cause of typhoid fever. You should remember that, especially this Salmonella serotype typhi, but Salmonella is known for causing typhoid fever. And do you remember Shigella causes dysentery, right? So Shigella causes bacillary dysentery. So we should know this answer, right? If your nephew gets gastroenteritis after cleaning out his pet snake's aquarium, the most likely pathogen is, remember, that would be Salmonella bongori, because that's the species that's found in cold-blooded animals. And then do you recall Yersinia pestis? You should know that Yersinia pestis is the cause of the plague. It is the bacteria that cause the plague. And it is spread by a vector called the flea. Okay. The reservoir are rodents and vole. The vector is the flea. And then the flea bites the human, and the human picks up the bubonic plague. And at that point, if the bacteria makes its way to your lungs, the human can spread it to other humans through respiratory droplets, and this is known as pneumonic plague. But a little bit more about bubonic plague. You should know that, again, Yersinia pestis causes bubonic plague, and with bubonic plague, you have these really swollen lymph nodes called buboes. You should know that buboes are a sign of bubonic plague, and that's caused by Yersinia pestis. And you should know what a bubo is. It's a swollen lymph node. And again, we did cover this concept check, but let's do it one more time. The bubo of the bubonic plague is a what? And again, remember that's C, an enlarged swollen lymph node. And that's it for chapter 20. I believe I touched on most, or if not all, of the important material to understand for the exam. Very interesting stuff. It's always good to know how these diseases are spread and what causes them. So let's go on to chapter 21 and continue with our review. All right, you guys, I don't know if you can see him very well, but there's Gizmo come to say hi. Hey, Gizmo, you here to answer questions? He's purring. He had a nice long nap. All right, Gizmo, you ready to launch this chapter of the review? All right, Gizmo. Chapter 21, let's go ahead and start with this. Remember, we're continuing on speaking about gram-negative pathogenic bacteria, and here we're talking about the spirochetes. And you should know that the spirochetes, They usually move because they can do that corkscrew motion, that motility, and that's because they have an endoflagella. Remember, it's also called the axial filament. That's an important factoid to remember about the spirochetes, which can, you know, get through viscous mucus because of that twisting. Next, we learned about Treponema, specifically Treponema pallidum. You should know that this is the spirochete that causes syphilis, the sexually transmitted disease. And what I would want to know are the 3 stages of syphilis, right? So, do you remember that during primary syphilis infection, this is where you form a lesion called the chancre at the site of inoculation, and this chancre is relatively pain-free. And remember that at this point, when you see the chancre, it can be easily treated with penicillin and other antibiotics. However, remember, if this progresses to secondary syphilis, this is when it kind of goes systemic, it gets into the bloodstream, and that's when you form that rash with all those little spots. You know, you form these spots on the palms and the soles with fever, and you can see those spots there. This is indicative of secondary syphilis. And remember, secondary syphilis is actually quite treatable as well with antibiotics. And remember that tertiary syphilis is characterized by this appearance of gumas, which are these really ulcerating syphilis tumors, and these irregular shaped irises, or pupils, I should say, the Argyll-Robertson pupil. And one thing I want you to know for the exam is that although it says here that, you would treat with antibiotics at the tertiary stage, typically those antibiotics are very much not effective at the tertiary stage. So unfortunately, when a patient lets the disease progress to tertiary syphilis, for the most part, it becomes untreatable, right? So make a note of that. And do you remember this concept check? If a patient presents with spotted rash and tests positive with a VDRL test, the most likely diagnosis is, and I would say it's secondary, because that spotted rash is just a telltale sign of secondary syphilis. And remember, tertiary syphilis is where you have the gumas and the Argyll-Robertson pupil, and you should know that the tertiary syphilis is where it really becomes untreatable. Remember the genus Borrelia? You should know that Borrelia burgdorferi is the cause of Lyme disease. And you should know that it's spread through tick bites. Remember, the tick normally bites deer and mice. Remember that the deer typically bites deer and mice. However, we are an accidental host, right? So we're like this accidental part of its life cycle. And do you remember what happens when you get that tick bite? If the tick delivers the bacteria, Borrelia, into your system, you end up with this bullseye-shaped rash called erythema migrans. Next, we learned about the curviform bacteria. Do you remember we touched on Vibrio cholerae? This is the cause of the GI disease called cholera. Remember, that's the one that results in diarrhea, the rice water stool diarrhea, it's been described as. And so, concept check. The main symptom of cholera infection is watery diarrhea for sure, right? Next, we learned about Campylobacter jejuni. Remember, this one causes gastroenteritis. We also learned about this interesting character called Helicobacter pylori, and you should know that this is the cause of most peptic ulcers, right? So ulcers inside of the stomach, as well as some stomach cancers. Next, we learned about the rickettsias, the chlamydias, and the mycoplasmas. You should remember that the rickettsias and the chlamydias are intracellular pathogens. You should know that rickettsia can cause typhus disease. So, for instance, Rickettsia prowazekii causes epidemic typhus. And it was Rickettsia rickettsii that causes the zoonosis called Rocky Mountain Spotted Fever. And do you remember how Rocky Mountain Spotted Fever worked? It involved a tick, and the tick bites a dog, and then the tick will then bite a human, and is what causes the spread of the disease. That's part of its life cycle. So, concept check number 5, the organism causing Rocky Mountain Spotted Fever is transmitted to humans through a bite of a certain tick. Although dogs are involved in the life cycle, the bite itself comes from the tick. And then do you remember Bartonella henselae? This is the cause of cat scratch disease. That's an important one to understand. This is where your lymphatic infection occurs and you get those swollen lymph nodes near the site of the cat scratch, like this. And do you remember the chlamydias? They cycle between two states, the elementary body state, which is metabolically inactive, but the infectious form, and the reticulate body state, which is not infectious, but it's actively dividing and growing. And do you remember chlamydia trachomatis can also attack the eyes, right? So it can cause what's called ocular trachoma, which is a severe eye infection as well. So it's not just chlamydia is not just a STD, but it can also infect the eye. And then do you remember Chlamydiophila pistachii, which is a zoonosis transmitted to humans mainly from bird vectors? That was interesting. And then Mycoplasma pneumoniae, another cause of pneumonia. And do you remember we touched on dental diseases as well? You should know about dental caries. Dental caries are damaged enamel. That's essentially what a cavity is. And you should know that what plaque is. Plaque harbors masses of bacteria which produce acid and dissolve enamel. In fact, you should remember concept check number 7, a biofilm found on the tooth surface that is made up of multiple species is called what? Remember, that's plaque. And that leads to the end of chapter 21. Let's go ahead and take our break time with Gizmo and Wicket, see what they're up to. All right, and the final chapter for exam 4, chapter 22. Let's go ahead. This one's all about fungi. One thing you should know is that fungi are relatively non-pathogenic. It's just a handful, about 300 or so, that are linked to diseases in animals. So most of them are not pathogenic. Most of them are not human pathogens or parasites. And you remember this term, so important. You should know that a mycosis is a disease caused by a fungus. That's what myco means. Myco means fungus, and mycosis are diseases caused by those fungal pathogens. And please know about the true or primary fungal pathogens. Remember, there were 4 main genuses, and you should know that they can invade and grow even in healthy, non-compromised hosts. They typically exhibit thermal dimorphism. Remember, they grow as molds outside of the human body at 30 degrees and as yeasts in and on the human body, which is 37 degrees C. Again, remember thermal dimorphism. The fungus grows as a mold on the human body, and it grows as a hyphae outside of the human body at that lower temperature. And remember, body temperature is 37 degrees C. And do you remember that most of these True or primary pathogens are found mainly North America, South America, and parts of Central Africa. So, concept check number 1. Which phase of the fungal life cycle is best adapted to growing in a host's body? Remember, that is yeast. Definitely know that. Hyphal occurs outside of the human body for that dimorphism. Next, you should know about histoplasmosis, aka Ohio Valley fever, and you should know that this is caused by Histoplasma capsulatum. Remember, this is the one that grows in moist soil that has a high nitrogen content, so you find it anywhere you find droppings from birds or bats. Next, we learned about coccidioidomycosis, or just plain valley fever. This is caused by Coccidioides immitis and Coccidioides posadacei. Remember, valley fever can cause these lesions on the skin. And do you recall? It's caused by inhalation of that semi-arid dust, that's kicked up, and you breathe that in. Next, we learned about blastomyces dermatitis, which causes blastomycosis, and this disease can present as lesions on the face, neck, and extremities. All right, concept check time. The primary reservoir for Coccidioides immitis is, do you remember this one was that semi-arid soil, so dry soil. Next, we learned about Sporothrix schenkii, which causes rose gardener's disease, also known as sporotrichosis. Remember this one? It's caused by a lesion in the skin. Like if you get a cut in the skin and those spores get inside, then there's this primary area of infection, and then there are these nodules that form up the lymphatics. Next, we learned about cutaneous mycoses. Remember, that means skin fungal infections, and it's those dermatophytes which cause dermatophytoses or ringworm or tinea. And you should know this for sure. You should know that ringworm is not caused by one species of fungi. It can be caused by one of 39 species which span across 3 genera. You don't need to remember or memorize the 3 genera, but definitely know that there is no one species of fungi that causes ringworm. And recall there are different forms of ringworm. You don't need to memorize all these different types of ringworm, but it's interesting to understand that, again, these are not caused by one particular fungus, but those 39 different fungal species across 3 different genuses. All right, let's do concept check number 5. Dermatophytic fungi attack the what in the what? Remember, the keratin of the skin, nails, and hair. Next, we learned about Candida albicans. This was an interesting fungus. Remember, it's part of our normal biota. However, it accounts for 70% of nosocomial fungal infections. And remember, nosocomial refers to diseases or infections that are picked up at the clinic, at the hospital. And you should know that Candida albicans causes vulvovaginal candidiasis, cutaneous candidiasis, as well as thrush, which affects the tongue. Here you can see thrush, caused by Candida albicans. Remember, Candida auris was very interesting as an emerging pathogen that is highly drug resistant. And lastly, remember we learned about the fungus Cryptococcus neoformans, which causes cryptococcosis. This is common in AIDS patients, cancer patients, and diabetes patients. This fungus presents itself as an infection, as a disease, when your immune system is compromised. And do you remember that you see these lesions on the skin as an early sign of this infection? And that leads to concept check number 7. Which of the following is the causative agent for oral thrush? Remember, this was Candida albicans. And that's it. Pretty interesting set of 3 chapters here for exam 4. I hope you learned a lot. Very interesting stuff. It really does touch on all those different microbes and what diseases they cause. And so let's move on. I wish you well on exam 4, but after that, join me for exam 5 materials.
Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. A Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. A Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. A Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D.